Welcome to the Optum Rx Pharmacy Insights Podcast. In this forum, we'll discuss the latest and most impactful events in pharmacy benefit management. In this episode, we'll examine some of the biggest challenges facing plan sponsors and some emerging solutions to help bend the cost curve and give them new insights into how their pharmacy benefit dollars are being spent. Today, I'm joined by Mike McGinnity, Senior Vice President of Growth and Retention at Optum Rx, as well as Sahni, Senior Vice President of Strategy and Innovation at Optum Rx. Good afternoon, gentlemen, and thank you very much for joining us. Before we get started, I'd like each of you to talk a little bit about your background and what your responsibilities are at Optum Rx. Sid, let me go ahead and begin with you.
Hey, Scott, thanks so much for having me. So I have been in the PBM industry now for 15 plus years. I have had the privilege of working in multiple parts of the healthcare ecosystem, including health plans and with pharma. And I really enjoy the role that PBMs have in this ecosystem, which is the focus on lowering costs for our clients and our members. At Optum Rx, I have the privilege of leading the strategy and innovation functions. The focus of me and my team is looking ahead, looking around corners, and developing solutions that address the challenges and capturing opportunities that our clients and our members face.
Great. Thank you, Sid. Mike, how about you? Tell us a little bit about your background and what you're responsible for at Optum Rx.
Thanks, Scott. And like Sid, thanks for having me. I'm a 20 plus year veteran of the PBM industry after spending a decade as a chemical engineer in paper manufacturing, if you can believe that. In the PBM space, I've overseen account management, sales, marketing, communications. I've dabbled in implementations, networks, you name it, just a broad swath of background and experience. Today, I report to our chief sales officer, and I'm in charge of business development, focused primarily on our consultant relations.
Sid and Mike, thank you for being here. Let's go ahead and jump right in. Let's start the conversation with one of the trends we're hearing a lot about in the marketplace, and that's the need for transparency. Mike, can you tell us how Optum Rx approaches transparency? And then maybe Sid, could you maybe follow up and add if there are any new transparency solutions plan sponsors should be aware of?
Sure, Scott, and thanks. This is a great place for us to start. Transparency is an important and often misrepresented or misunderstood subject in our marketplace. Today, the fiduciary responsibilities of our plan sponsors are being questioned, so it's important for Optum to equip and enable our clients with data and information to uphold their obligations. At its essence, transparency is that access to information for all of the stakeholders within the pharmacy benefit ecosystem, including members, pharmacies, providers, clients, and consultants. For our clients and consultants, transparency is access to our independent P&T committee so they can see the decisions we make about which drugs should be on formulary, could be on formulary, or should not be on formulary. They have full audit rights, so all of the terms and conditions within our contracts can be validated through independent third parties. For our members, they have access to all sorts of information through the client portals, including what drugs are covered, what is the drug price of those covered drugs, which pharmacies can they go to, and which pharmacies offer them the best deal. Does their drug require a prior authorization, and what are those requirements, and can they initiate it online? We also give them copay card guidance, so if there are manufacturer-sponsored ways for them to reduce their drug price, they can get that information as well through the portal. For our pharmacy partners, there are 26,000 plus independent pharmacies across the country, and we allow them to contract directly with Optum instead of joining a PSAO, which could limit their flexibility and also increase some of their costs. In addition, we don't participate in any clawback or retrospective recoupments from independent pharmacies or from any pharmacies whatsoever. And for our providers, we give them access to PreCheck by Script, which gives them formulary and utilization management information right in their workflow. It provides cost information and covered medications information similar to what members would see in the portal. It shows if a prior authorization is required, and it can be initiated immediately through the electronic prior authorization system, or a provider could choose to prescribe a different therapy that doesn't require prior authorization and circumvent that entire process. Just a couple of small examples of transparency for all of our stakeholders, but it really is access to information. Sid?
So well said. Transparency is not new or transient at Optum Rx. It is the core of how we choose to operate. The next step in our ongoing commitment, in January, we announced that we will pass through 100% of the rebates we negotiate with our manufacturers to our clients by 2028. And that is up from the 98% that we do today. And this is to eliminate any lingering doubt on the PBM's financial incentives. Of course, we are encouraging our clients to now pass these discounts on to their members. An example of the transparent marketing offering that we launched last year was Cost Made Clear. This provides clients a choice of a fee-based pricing structure that is independent of drug costs. More recently, we launched Clear Trend Guarantee, which aligns our clients and our interests on controlling changes in pharmacy costs in a value-based structure. In addition to the transparency that we provide to clients, transparency to consumers, as you mentioned, is just as important. So our digital tools enable members to search for prices of a prescription and see lower cost alternatives. And our solutions such as Price Edge automatically incorporate lower off-benefit prices on benefit so that members don't have the burden of doing the search themselves. So this is an area that we continue to innovate, and we expect that we will bring a lot more forward as 2025 goes on.
Outside of transparency, the other topic that seems to come up quite a bit is the GLP-1 topic. How are you managing GLP-1s? So GLP-1s, of course, are those medications that are primarily used to treat diabetes and obesity. Mike, what are the macro trends surrounding this drug class? And are there any specific pain points plan sponsors are facing that are spurring the need for innovation here?
Yeah, there sure are, Scott. Our clients definitely need help to ensure they're providing access to critical medications for the members, but they also need guardrails to promote proper use and adherence. So today we see 77% of traditional drug trend is being driven by these GLP-1s and 42% of overall trend, which would include specialty drugs. More than half of US adults are already eligible for these products, and more are going to be on the way with new indications for such things as sleep apnea, heart failure, chronic kidney disease. We have clients that just need help deciding what they should cover and for whom and with what protections and parameters.
Sid, what can plan sponsors do about this today? And how is Optum RX helping clients navigate this critical space?
Yeah, as Mike indicated, the key challenge is the prices of these medications as set by pharma is just too high, especially for a drug that has such broad use. So we negotiate with manufacturers to bring those prices down. We also offer a comprehensive solution called Weight Engage to our clients. Part of this is utilization management, where we can ensure that the medication is given to those that meet the drug's clinical criteria and is getting to those that need it the most. In addition, we offer a behavior change program for patients, and this helps support them on their medication journey. We're actually proud to offer many different options that clients can choose from, included one that is provider guided and one that is member driven. This is an area that we remain restless in. We understand how big of a challenge this is for our clients and members, and a tremendous amount of energy is focused inside Optum RX, and you will see us bring new solutions in 2025 that help address this need.
Right, you're in the market every day. Outside of the GLP-1s, what other key market dynamics and client challenges are you seeing?
Yeah, you're right. I talk to consultants on a daily basis, and they're representing all of their clients. Right after GLP-1s, we talk about biosimilars, and when they need help navigating high WAC products, low WAC products, the impact to rebates, the impact to net cost. They need help with cell and gene therapies. These are critical medications, incredible advancements in medicine, but plan sponsors need our help to limit their financial risk while maintaining critical access. Cell and gene therapies can cost between $1 and $3 million with a median launch price near $300,000. annually. There are now approximately 160 medications that cost over $250,000 a year. One more thing we talk about quite regularly is regulatory issues. There are multiple pieces of legislation, newly signed and emerging, that impact the industry in a big way, including steerage limitations, home delivery versus retail, that can increase cost for plan sponsors. There's pricing pass-through regulations that limit plan sponsor choice. And there's Medicare Part D and IRA changes for members, including member prescription payment plans, that's helping to alleviate some of the high cost of medications.
Sid, what about from your perspective?
More broadly, specialty medications continue to pose challenges. Our portfolio of specialty medication management solutions enables clients to forecast trend, bring together medical and pharmacy benefits to determine optimal coverage, ensure best site of care, provide ongoing review to ensure the spend is appropriate, and also offer risk protection if the clients choose to buy it. We tie all of these elements together to work cohesively in our unique specialty fusion offering. Also, our specialty pharmacy runs Savings IQ, and this automatically matches eligible patients with saving opportunities and has saved over $2.5 billion in 2024. So as you can see, our approach to managing specialty medications is quite comprehensive. And finally, Mike mentioned the prescription payment plans in Med D under the IRA. This is an example of where we spotted a market need early and are proud to be the only major PBM with an end-to-end solution for health plans so that they can remain compliant and offer the members the benefit of spreading out-of-pocket costs, which of course drives affordability and adherence, things that we're very passionate about here at OptumRx.
Is the both of you kind of pointed out so far are really from the perspective of a plan sponsor. So Mike, can you talk a little bit about some of the biggest challenges facing consumers? And then maybe Sid, can you dig into what OptumRx is doing to improve consumer affordability and experience?
Yeah, at the top of the list of concerns for consumers is cost, and closely followed by that is cost again. Yeah, members are 83% of Americans say drug costs are unreasonable. 51% of Americans struggle to afford health care. 1 in 4 Americans struggle to afford their medications. 1 in 5 adults actually skip their medication as prescribed versus 1 in 10 in other developed nations. And if cost weren't the only two issues that members had to face, they're bombarded with advertising every time they turn on the TV about a miracle medication that's going to cure their ailment or make them feel better. And many of those medications are very good, but they get confused because they don't have all the information about what's the right drug for them at the right time at the right cost. And so they just have a lot of competing information and they struggle with making the right decisions. Sid?
So first and foremost, we negotiate with pharma and pharmacies to lower the cost of prescription drugs. On average, we're pleased to report that OptumRx saves clients $2,000 per person per year. We offer a suite of programs that are both provider and consumer facing to help improve the experience as well as drive savings. For example, the PreCheck My Script program gives prescribers real-time drug cost information within their workflow, and that can save clients an average of $266 per fill and an average of $119 per member. Our critical drug affordability program offers low or $0 cost sharing on more than 170 essential medications. Today, 98% of all OptumRx consumers have access to insulin for $35 or less per month as a result of this program. The preventative drug list ensures access to preventative drugs for at-risk members, and this drove more than $21 million in out-of-pocket savings for consumers last year. Price Edge, which automatically includes off-benefit pricing on benefit, has saved an average of $32 per script and total member savings of over $150. And finally, I'll mention Optum Home Delivery, where 51% of the prescriptions had a $0 copay last year. We're looking to continue to innovate in all of these areas, enhancing current solutions, and of course, developing new ones.
Sid, can you give us a sense of innovation as a discipline? How does OptumRx think about future innovation and making innovation a sustainable process?
Yeah, in innovation, it's actually very tempting to get attracted to the latest shiny object. And we instead take a very disciplined and methodical approach to innovation that is focused on outcomes for our members and our clients. Today, we have 30 to 40 products at various stages of development. Now, not all of these will come to market, but we have a healthy pipeline that addresses the varied needs that our constituents have. So I would characterize our focus areas into these 5. First is around improving consumer affordability and experience. Second is around controlling specialty costs. The third is around transforming pharmacy benefit management, the core of what we do on a daily basis. We then go beyond pharmacy, and in our fourth one, talk about total cost of care and helping people get well. And the fifth, last but not least, is around advancing emerging frontiers. These are the new, the innovative, the shiny things that we want to keep an eye on, but want to bring to market solutions once we have confidence in the value that they create. So specific examples that you will see us come to market with here in 2025 is expansion of GLP-1 solutions and specialty solutions, both of which we know are top of mind for our clients. You'll see solutions in oncology, women's health, and behavioral health, to name a few. So it's a very exciting time here at OptumRx.
Right. Give our listeners a peek into what might be around the corner in the not so distant future.
Yeah, well, first, I want to say it's a pleasure to work with Sid and his team and be able to roll all these solutions out to the marketplace that are so beneficial for our clients and their members. A couple that come to mind right now, from a member experience and a provider experience perspective, we're working through and have launched low touch, no touch PAs, which really eliminates the need for providers and their administrative staff to go through lengthy clinical questionnaires that they may have received through a fax machine. Instead, it's automated clinical data retrieval and approval right through the workflow of the provider through the EHR and electronic prior authorization connectivity. It reduces burden by eliminating duplicative clinical documentation and expedites patient access to medications. We're able to approve up to 65% of cases on the spot. The pre-check prior authorization program has helped reduce our average PA approval time from 8.5 hours to 29 seconds. Providers are seeing an 88% reduction in appeals and a 68% reduction in denials caused by lack of information because the information is retrieved from the system if it's there. Health plans are seeing 62% of all approvals that can be automated, and pharmacies are seeing a 99% decrease in time to complete clinical questions. This is a tremendous outcome and a tremendous advancement in the prior authorization product. In addition, we're currently rolling out Benefit Central to all of our clients. This is really bringing us back to the beginning. It's all about transparency and giving our clients access to information. It's a reimagined, simplified client portal experience and so much more. It's an intuitive design and self-service plan management with a new user-friendly interface. Really at its core, we're allowing access to automated plan builds with flexible and accurate information, averaging 32,000 new plans loaded into our claim each year, and enhanced client reporting. Without reporting, our clients are flying blind. They have dynamic real-time data and actionable insights when they need it, and they don't have to rely on contacting their account teams. And so this is just one of the many examples we talked about today of transparency and providing information to all of our stakeholders when they need it and how they need it.
Sid and Mike, thank you for spending time with us. Thanks for listening to the Pharmacy Insights Podcast. I'm your host, Scott Draeger. Tune in again for more discussions as we examine the most important issues in pharmacy care services.